You are tuned in to the MEDIMAGZA podcast. Hello and welcome to another exciting MediMag Live, the podcast. Today, of course, we have a very exciting guest for you, one of MEDIMAGZA's own, Anushka Singh from Dr. Legal. Now, if you have been following the socials, you'll see we've been interacting quite a lot with Dr. Legal, especially in the magazine. Just a brief background of them, though. Dr. Legal, who specialize in providing comprehensive healthcare and compliance solutions tailored to the unique needs of healthcare professionals. Now, their focus is on ensuring that your practice meets all regulatory standards while enhancing patient care. Welcome to the show, Anushka.
Clive, thank you. It's been lovely interacting with you over the last couple of months, and it feels wonderful to be able to have this face-to-face time with you. So, thank you very much for having me with you today.
No, that's fantastic. Thank you as well. Now let's dive straight into it. Your tagline, simplifying healthcare compliance. What inspired you to launch Dr. Legal, and what is the core mission behind the brand?
So, as both a lawyer and somebody with a keen interest in healthcare and healthcare professionals, I saw that there was a struggle on an emotional and an administrative side that came with the work that healthcare professionals do. Nurses and doctors don't have the time to sit with their paperwork, and they get buried under this regulatory framework that stems from HPCSA and from SANC. And at the same time, they have to fulfill their duty by showing up for patients.
Mm.
And it leaves them in a very sticky situation because without their regulatory compliance, there's trouble for them from the HPCSA. And if they're not showing up for their patients, then what are they doing? So, yes, one missed clause in an indemnity form at the HPCSA could lead you to having a fine, to having your license taken away from you. And so there's so much admin that comes with the profession. I thought somebody needed to help them, And so I launched Dr. Legal to change that story. And our mission is simple, to protect practitioners so that they can spend time with their patients. End of story.
Mm. No, I love that. It's so simplified. You make it sound so tailor-made, so easy to fit. It's actually fantastic. Now you offer compliance auditing, ethics,
Yeah.
and CPD training and legal advisory services, which many hats to wear, which is super impressive on its own. Amongst these, which do you feel resonates most with your clients and why?
The ethics and CPD resonate most because that is the part that really empowers practitioners to understand the law on a very simplified basis.
Right.
I'll give you an example. We hosted a CPD workshop with a group of young doctors from Cure Daycare. And after the session, one of the doctors came up and said, wow, today feels like I didn't just tick a compliance box. I felt like I learned something that could actually help me in my practice. And that was just such a lovely bit of feedback to hear from a doctor because usually after a CPD session, everybody leaves and they're not really too keen on what the speaker really had to say. But for that one doctor to come up to us and say, thank you. It wasn't just a compliance tick box. I learned something that really allowed us to see that, okay, what we are sharing is of value and is needed by doctors. So the ethics and the CPD definitely come up as the most crucial part of what we do. And one of the doctors actually also said to us, and I actually wrote this down because I thought it was so profound. It said, for the first time, I don't feel scared of compliance. I feel like the transformation is the skills that I'm learning. So that allowed us to see that doctors are afraid of compliance. They hear the word. HPCSA puts out documents and documents of legal criteria, but there's nobody in the middle that's saying to the doctors, well, nobody up until now, saying, come on, this is what we're going to do for you. We're going to simplify that for you and make sure that you can spend time with your patients. And we take care of your compliance by simplifying just what you need to know.
Mm. No, definitely. I feel that little bit of recognition that you least expect is the biggest message and take home sometimes, you know. Now, South Africa's healthcare professionals, must navigate complex frameworks, as you know. I mean, like you said, HPCSA regulations, POPIA, ethical standards, and more. What's the biggest compliance challenge you've helped clients overcome?
Oh, definitely, Poppy. Protection of personal information. That at the moment is just all the rage. And in day-to-day practice, doctors often underestimate how data security is part of patient care. We once worked with an optometrist group who stored patient files in an unlocked cabinet.
Oh,
After we completed our audit, we implemented a compliant digital system for them to rather have all of their files put onto a digital system. The doctors later shared that patients even noticed the change and started understanding that their personal information was now being protected in the way that it should be.
mm,
And so compliance isn't bureaucracy, really. It's an extension of care and it's an
mm,
extension of compassion.
yeah.
So certainly Poppy, and it's still so big on the radar for what many doctors need to comply with.
Yeah.
Yeah.
No, definitely. I mean, when it comes to, a lot of doctor-patient confidentiality, I think sometimes, I mean, I worked in a hospital last year as well, and it's ongoing. You notice the patient sometimes is a little nervous to say a lot of things to the doctor, but I think knowing that they're fully covered in protection and just their own personal messaging, I think that's so powerful. Now, moving on to an educational aspect, or impact rather. Your tailored ethics and CPD training is tailored to keep practitioners currently within legal requirements. Can you share a memorable success story from one of your, sessions? Maybe a moment when things really clicked for the attendees.
Yes, there's a few. There's a few, and there's one that was very recent and very specific. We were with a group of oncology nurses, and they entered the room feeling very heavy and not sort of quite understanding why they needed to be there and who we were, but they entered the room. They were exhausted, they carry the burden of their patient's pain and their own doubts about compliance and as to whether why they should be there in the first place. And halfway through one of the sessions, we reframed compliance as an act of compassion.
Wow.
And shifting the word compliance to compassion suddenly just brought down the level of fear and the level of disinterest from the nurses. Because at the end of the day, healthcare professionals are there to care and serve and to be those compassionate doctors and nurses that we so claim to want to have and experience in our hospitals. And that moment was such a beautiful amalgamation of how the law suddenly became an area of care. And
Mm.
it was the most beautiful thing to suddenly see everybody sitting up in their chairs and taking a little more interest in what we were saying. And just before we were completing, one of the nurses came and she said, I came in dreading this legal talk, and I'm leaving reminded why I became a nurse in the first place.
Congratulations, Dr. Legal. That in its own is such a feat. Well done on that
That
one.
was beautiful. Thank you. And I loved
Mm.
I that story for me still gives me goosies because it was so real and it was such a tangible difference from the moment the nurses were with us to the moment that they left. And
Yeah.
it was beautiful. And to relate compliance to compassion, there's something so soulful about
Yes.
that. And I think anyone who knows and has worked with us at Dr. Legal, we often talk about soulfulness and why we are in this. And so definitely compliance and compassion, that's a winning combo for us.
That is beautiful. You could name a
Yeah.
book that. It actually sounds like the title of
I'm
something
gonna,
great.
I'm gonna write that one down. I like that. I love that. I love that.
Speaking of which, you've received praise, okay, from the South African Dental Association, Cure Day Clinics, and Zeus
Yeah.
Optometrists, just to name a few. What's one piece of client feedback that stood out for you and why?
Yeah. I think we're very blessed to be able to work with these amazing organizations who have seen the benefit of what we do. Um, SADA, South African Dental Association, they certainly stand out as one of the top tier groups because of the number of members they have. And they said to us that we didn't just give them compliance, we gave them peace of mind. And peace of mind is today in 2025, I think one of the hardest things to find. And it's something that we're all searching for. And to be able to hear that from a group of 500 dentists, after a very not such an interesting talk, we spoke about sexual harassment in the workplace. And that wasn't an easy topic by any means to present to a group of over 500 doctors. And yet, in them understanding the compliance, gave them peace of mind. And so that was a beautiful moment and stands out certainly as one of the moments that give us just a little bit of goodness that remind us of why we do what we do.
No, that's fantastic. And well done again. Oh my word.
Thank you.
Now, something I really enjoyed when I first stumbled upon Dr. Legal as from the MEDIMAGZA community. You offer 15 minutes complimentary consultation. What
Hmm.
typically unfolds in that initial call, and how do you use that time to deliver value right away?
Yeah. So we listen. The first 15 minutes are really for us to listen. Often, a nurse, a physio, or a doctor would come to us quite anxious and unsure of whether they even need our services or whether they're in trouble. And in those 15 minutes, we can map out their main risks. We can give them a clear, actionable step as to what needs to happen regarding their legal situation. And one GP recently told us that in that one call, I finally understand where to begin, because there's so many different areas. Do I start with the audit? Do I start with my training of my staff? Do I get all my CPD points? And we just managed to map out what he needed to do. And he was like, okay, let's get going, So it's really to listen and it's to give the doctor, the nurse, the allied health professional an opportunity to really just share their grievance with a sound attorney and give them a plan forward. And that's just really nice. And that's our way of being able to give back and get the momentum started for continued relationship.
That is really beautiful. And once again, for our viewers watching, take benefit from that 15-minute complimentary
Yeah.
consultation because it really, really is beneficial. Moving on to some motivation and taproots. What drives you daily, Anushka, as a healthcare compliance expert? What motivates you to continually support and empower practitioners across the country?
So my best friend is a doctor, and I see what goes into everyday work into our healthcare system, whether you are in public or whether you are in private. And the support, unfortunately, that comes from public or private is so minimal. And for me to be able to sit as an attorney and know that what I can do can benefit what a doctor does on a daily basis is a lovely feeling. And I wake up feeling fulfilled that my work is noble and that we're not taking anybody for a ride or a run. And there's a humanness behind what we do. And that fulfills me beyond anything I thought would in the law because I've had my own journey in the law and it hasn't always been this lovely.
Mhm.
Um, and so, in giving back, it gives healthcare professionals an opportunity to be their best. And we know that our healthcare system needs all the support that it can. And so, in our little way from Dr. Legal, if we're doing what we're doing, then I think we are adding to the whole and somehow making the circle fuller and better. I'd
Mm.
like to think so and hope so.
I love that nobility, humanity, and just fulfillment. Those three are so powerful in any walk of life. So thank you for actually mentioning that. Moving on to growing with partners, and I can tell you we loved having you on our journey so far. MEDIMAGZA is proud to have you as one of our favorite resident writers and strong partners at that as well. How has your relationship with MEDIMAGZA influenced your work, and what excites you the most about being a part of the MEDIMAGZA family?
Ah. Gosh, this is going to make me emotional because Medimags have given Dr. Legal a national footprint and a national voice that we didn't have when we just started out last year, September. We are just about to be 1 year old next month. And the platform has allowed us not to just share a compliance checklist, but real human stories, about what's been happening and real life situations that can actually and are happening in practices. And that excites me because it means the conversation is shifting. Compliance isn't just dry law, it's really a living, breathing plan and a protection for people who dedicate their lives to care. And so Medimags have given us a big space to operate and to share what we do. So thank you.
No, thank you. Thank you very much. And it's really been an exciting journey, I gotta tell you. Looking forward to the future. Also, prior to that, we would love a cake for your first birthday. We'll be looking out for our Dr. Legal specialized tailored cake. Looking ahead, what new services, tools, or initiatives do you envision for Dr. Legal launching, in the coming year? And where do you see the practice heading in the next 3 to 5 years?
Yeah, that's such a beautiful question because it's really forcing me to think ahead and look ahead. So in the coming year, we'll be launching a digital compliance toolkit for solo practitioners. Especially nurses who are running private practices and community-based doctors. Too often they are left out of the big compliance conversation, and we realize that there is a gap for us to give them their toolkit in a more simplified way. So that's what we're busy doing. And in 3 to 5 years, wow. I envision Dr. Legal as the most trusted partner for every healthcare professional in the country, whether they're in Johannesburg at a clinic or at a rural mobile unit. We're
Hmm.
hoping to go across the borders into our neighboring countries and expand into countries like Kenya and Zim, where healthcare compliance is actually a little more up to date than we are in South Africa, and we're hoping to learn from them. So we're hoping to do some cross-border work and to be able to bring our continent together in a better way than we can or than we're currently doing right now.
That is really amazing. I think the future is definitely brighter with a Dr. Legal in it, especially in the coming 3 to 5 years. I think those digital initiatives are so important, especially for the smaller guys out there, that don't always have the representation. And I'm so glad Dr. Legal is blazing forward and getting this going, this very, very important conversation. Finally, thank you so much, firstly, for, being on the show with us and being with us through the year. Finally, what inspiring advice or takeaway would you like to share with healthcare professionals listening today as something that will help them stay compliant, confident, and patient focused?
Hmm. So here's what I would love to share, that compliance is not a burden. And let's rather look at it as a protective shield. And when you simplify and align with it, you don't just protect yourself legally, you protect your patients, the
Mhm.
profession, and your peace of mind. And so, to every nurse, doctor, therapist, and healer listening, you don't have to walk this road alone. Dr. Legal is here with you, and we look forward to joining you on that 15-minute complimentary call real soon. And
Awesome.
thank you.
How can anyone reach out to get in contact with you?
Oh, fabulous. So, we've got all our social medias are active and they will find us on Dr. Legal. Our Instagram page is quite busy. We're on TikTok under Dr. Legal, LinkedIn, Dr. Legal, and then info@drlegal.co.za. That's an email address. Or they're welcome to directly WhatsApp message us on 073-274-8045, and they will find the link to the Calendly appointment, book their 15-minute call, even if they just want to say hi and want to know a little bit more about us. We've got them covered. And we look forward to what comes from this moment.
Perfect. Okay, Medimag ZA family, there you have it. Dr. Legal was in the building. Look forward to more content from her coming in the new issue of Medimag ZA. Thank you so much, Anushka Singh from Dr. Legal, for joining us today.
Thank you for listening to the MEDIMAGZA podcast.